Many kids have the start of summer break on their minds, but it's not too early to start thinking about crossing off some items on your kids' back to school list. Joining us live with more information on school and sports physicals is Mary Franks. She's a nurse practitioner with Unity Point in School Health. Mary, thanks so much for joining us this morning.
Hi, good morning. Thanks for having me.
Absolutely. So Mary, why is it so important to start scheduling their children's physicals now?
So it's really important to start scheduling the physicals now because these physicals are actually good for a full 365 days. So even if you get your kids scheduled today for a physical, it's still good this fall when school starts as well as into next year at the same time. A lot of parents find that timing is important to them. So if they are having to remove their child from school or having to take time off of work in the fall, winter time to get those physicals done, that's not real good timing for them. So they find it's easier to get appointments that they desired at a desired time for them in the late spring, early summer months.
And Mary, what are some of the things addressed at these physicals?
So there's a lot of things that are addressed at physicals. We actually discuss developmental milestones through all age groups, even age 18 and up. That pediatricians see. We can also address immunizations at the time because we want to make sure our children are immunized appropriately at their age ranges for school. The developmental milestones are important because we can make sure that there's a good transition, an easy transition for school when school starts to ensure that those concerns that the parents have are being addressed prior to school starting.
And with the pandemic kind of going on, there might be some people who are hesitant about going into the doctor's office. Oh, how has COVID-19 kind of been impacting these visits?
So the biggest challenge we're finding right now with school physicals is actually with the sports physicals. COVID affects everyone so differently right now that we're finding a lot of different patterns in how children are recovering, how individuals as adults are even recovering. So the American Academy of Pediatrics actually recommends that any child or adolescent who has had COVID-19 in the past 6 months prior to the school or sports session is starting, have an evaluation, a return to sports or post-illness visit, similar to how someone would have a visit for a post-concussion prior to that sport starting, so they can make sure that they are healthy enough to participate in that sport. These visits, as far as post-illness related to COVID, can be lengthy depending on symptom severity of the child or adolescent. And we want to make sure that any further tests that need to be done or referrals need to be done are done in a timely manner. And that process can be lengthy.
And before we go, we've got about 45 seconds left or so. But can you tell us just a little bit more about Unity Point's in School Health and how local students can access care through it?
So Unity Point in School Health has been around for about 20 years working with Peoria Public School System. We actually provide school nurse services in Pekin, East Peoria, and Pleasant Valley school districts. And then we also have clinics inside Peoria High School, Manual Academy, and Treewen K through 8 school. So the parents can, any parent or child in the Peoria Public School System can access our services.
All right, Mary Franks, thank you so much for joining us this morning.
Thank you. Have a great day.
You too. And we will share this information on our website, ciproud.com.